So let's discuss on another important topic, that is PNS, paraneoplastic syndrome. Paraneoplastic syndrome. What is paraneoplastic syndrome? Paraneoplastic syndrome are a group of conditions developing in patients. It is a group of conditions developing in patients with advanced cancer, which can neither be explained by direct or distant spread of tumor or nor by the hormone eruption. These are the PNS, paraneoplastic syndrome. एडवांस कैंसर में होता है. एडवांस कैंसर जब हो, एडवांस कैंसर में होता है और इट कैन नॉट बी एक्सप्लेन बाय द direct or distant spread of tumor or nor by the hormonal aberration. These are all called the paraneoplastic syndromes. So in the paraneoplastic syndrome, let us discuss endocrine syndrome. Endocrine syndrome first, hypercalcemia. Hypercalcemia. First, what is called ectopic hormone? Ectopic hormone is the hormone or hormone-like substance which are produced by the cancer cell of non-endocrine origin. This is are all called ectopic hormone. Now, hypercalcemia. Hypercalcemia occurs by the elaboration of parath hormone. Occurs by the production of the parath hormone like substance by the tumor. It occurs in carcinoma of kidney, carcinoma of lung and breast. So this is called hypercalcemia due to the elaboration of the parath hormone. Now hypercalcemia also occurs due to increase in the vitamin D, or excess production of the vitamin D. Now hypercalcemia. Then second, Cushing syndrome. Cushing syndrome is due to, in this there is increased production of ACTH or ACTH-like substance. It occurs in Cushing syndrome. It occurs in small cell lung carcinoma, and carcinoid tumor. Now ectopic antidiuretic hormone production. It occurs in small cell lung carcinoma, and carcinoid tumor. There is an increased production of the ADH, antidiuretic hormone. Now hypoglycemia. Hypoglycemia occurs due to the ectopic production of insulin-like growth factor, IGF-2, insulin-like growth factor 2, ectopic production of insulin-like growth factor. So there is hypoglycemia. It occurs in fibrosarcoma, hepatocellular carcinoma. So now let us discuss another, HCG, human chorionic gonadotrophin, HCG. Due to the ectopic production of HCG by the embryonal carcinoma of testis and extragonadal germinomas. Now second, this is all about the endocrine syndrome: hyperglycemia, Cushing syndrome, ectopic ADH production, hypoglycemia, and HCG. Now let us discuss hematological syndrome. There is erythrocytosis. Erythrocytosis due to the ectopic production of erythropoietin. It occurs in renal cell carcinoma, hepatocellular carcinoma, and CNS tumors. Now thrombocytosis. It occurs due to the ectopic production of interleukin 6 and thrombopoietin. It occurs in cancer of lung and GI tract. There is also occurs leukocytosis, mainly granulocytosis. Anemia. Anemia is associated with the B cell malignancies. So this is all about the hematological syndrome. Now let us discuss vascular syndrome. Vascular syndrome. Most common thrombotic complication is seen. Thrombotic complications seen are deep vein thrombosis, deep vein thrombosis, pulmonary embolism, and non-bacterial thrombotic endocarditis. These are the common thrombotic complications. Now in this, what is Trauze's syndrome? Trauze's syndrome is coexistence of venous thrombosis with the visceral cancer. Coexistence of venous thrombosis with visceral cancer. This is called Trauze's syndrome. Okay. Now, on osseous joints and soft tissues, there is clubbing of fingers seen in lung of cancer, and it occurs due to increased blood flow. Now, neuromuscular syndrome. In neuromuscular syndrome, in 5% individuals who have developed cancer, there is associated with the destruction of neurons throughout the nervous system without evidence of metastasis in the brain and spinal cord. It is mediated by immunologic mechanism, and changes which are seen following to neuromuscular degeneration are peripheral neuropathy, myasthenia gravis syndrome, and polymyositis. So in neuromuscular syndrome, there is destruction of neurons throughout the nervous system. There is destruction of neurons throughout the nervous system in neuromuscular syndrome. Now, what is in cutaneous syndrome? Cutaneous syndrome is characterized by first acanthosis nigricans. There is black warty lesion in the axilla and groins. It occurs following the cancer of stomach and lung. Black warty lesions are seen. Acanthosis nigricans. Black warty lesions in the axilla and groins appear following the course of cancer of stomach, large bowel, and lung. Now, other acanthosis nigricans, other are seborrheic dermatitis. Now, let us discuss renal complication. In renal vein thrombosis is seen. And it results into the nephrotic syndrome. Now, malabsorption syndrome. There is malabsorption of the dietary factors. Okay, dietary components, malabsorption of the dietary components, as well as hypoalbuminemia. Okay, amyloids. Primary amyloid deposit. It occurs in the multiple myeloma. Primary amyloid is seen in the multiple myeloma. And in renal cell carcinoma, there is secondary amyloid deposit seen in the renal cell carcinoma. Primary deposit in multiple myeloma, and secondary amyloid deposit in the renal cell carcinoma. Okay. So this is all about the paraneoplastic syndrome.